Obesity has become one of the most serious public health concerns of the 21st century. It has reached epidemic proportions, and the numbers continue to rise.
33% of the people in the United States are considered obese at this time, and 16% of youth from ages 2 to 19. And that's really a travesty when you think about our youth are growing up in an environment today where they're overweight, they're inactive, and they're destined for medical problems in the future that they normally wouldn't have if they were at a normal weight.
Obesity is a chronic disease that, if left untreated, can cause serious health problems, such as diabetes, heart disease, and many forms of cancer. Most medical professionals view obesity as a disease and not as a lack of willpower or self-control.
There are many diseases that are associated with obesity. In fact, obesity affects every part of the body, but probably the most serious ones are type 2 diabetes, hypertension, high cholesterol, and sleep apnea is another big problem that's associated with people that are overweight or obese. They estimate that the associated deaths with people who are overweight could be up to 300,000 people a year. The bulk of physicians today realize that obesity is a chronic illness.
Obesity greatly reduces a person's quality of life by making it difficult to perform activities of daily living, playing with children and grandchildren. It causes many physical limitations such as denial of insurance, discrimination by airlines, theaters, restaurants, and even employment.
You know, patients tell me they didn't get the promotion with their job because of their weight, or they didn't get the job at all because of their weight.
Dr. Stephen A. Tersini of Bay Bariatrics in Coos Bay, Oregon, is certified by the American Board of Surgeons and has specialized in general and laparoscopic surgery for 11 years. Bay Bariatrics has been recognized as a center of excellence.
A center of excellence is an institution that abides by certain regulations in order to provide optimal care to the bariatric patient. In the past, there have been too many institutions or too many surgeons who have gone to a weekend course and learned how to do bariatric surgery, and then come back and try to do bariatric surgery, and there's been horrible outcomes.
The current obesity epidemic stems from a number of different causes or influences. We live in a society where high-calorie, supersized foods are readily available and barraged with advertising that promotes unhealthy eating. It has been said that genetics loads the gun and the environment pulls the trigger.
They have a genetic susceptibility, but there has to be an environmental factor or a behavioral factor that actually pulls the trigger and causes a person to become obese or triggers that genetic susceptibility.
Diet and exercise don't always work and have been unsuccessful in over 95% of severely obese patients. According to the United States National Institute of Health, morbid obesity is described as being 75 to 100 pounds over ideal weight or having a body mass index of 40.
In most cases, when a person has gained a significant amount of weight, it's very difficult and discouraging for them to lose weight, because what happens normally is a person will lose weight and they're motivated for the first month or two, and then they lose weight, and then suddenly they reach a plateau and they get discouraged and then they stop. Now, body is built to maintain homeostasis, so to speak, or a steady state, and it wants to maintain that weight that it perceives to be its normal weight. Now, the big question is, why does my body think I should weigh 200 pounds and someone else thinks it weighs 300 pounds? And that's probably the million-dollar question. The problem is that once a person gains a significant amount of weight and their body perceives that's their ideal weight, then it's going to do everything it can by slowing metabolism, excreting certain hormones to keep it at that weight.
Morbid obesity is a manageable condition, just like any other chronic disease. Most patients lose significant weight, regain their health, and successfully keep their weight off through bariatric surgery.
We found that with our procedures, either the lap band or the bypass, we have a better than 75 to 80% success rate of eliminating type 2 diabetic medications.
Surgical breakthroughs such as the lap band system and the Roux-en-Y gastric bypass are some of the most common surgical procedures performed in the United States today.
The band is placed around the top of the stomach, creates a small pouch above the stomach, and the band controls the outlet to that pouch. So when the pouch fills up with food, it gives the patient a feeling of fullness or satiety, empties slowly. The patient eats less and they lose weight. The Roux-en-Y gastric bypass creates a small pouch, but also bypasses a portion of the small intestines.
Bariatric surgery is a permanent surgical procedure causing a reduction in the patient's appetite and eliminating the body's desire to overeat.
It restricts the amount of food they can eat by the size of their stomach. With both the band and the bypass, the gastric pouch is smaller, so it can only accommodate a certain amount of food.
Bariatric surgery is the most successful form of long-term weight loss and helps patients reach a healthy weight. In most cases, it improves their weight-associated diseases, such as diabetes, high blood pressure, heart disease, and high cholesterol.
I was on Lipitor and statin, and after the weight loss, my doctor took me off of the cholesterol medication, which was great.
What I tell patients when they come in for their consultation is that surgery is a great tool, but there are basic things that they're going to need to do for life for them to be successful. They need to stay away from high-calorie beverages. They need to exercise. And really the key with exercising, I believe, is to find something that you love to do. You will not reach your goal weight if you don't exercise.
Clinical studies evaluating the effectiveness of bariatric surgery in patients with morbid obesity have shown an increase in longevity, a decrease in heart disease, an average remission rate of 75% for diabetes, and a cure rate of 61.7% for hypertension and 85.7% from sleep apnea. Weight loss surgery is a tool and must be used properly. Patients need to modify their eating paradigm and resolve to eat to live rather than live to eat. Exercise and proper food choices also determine their long-term success.
I used to live to eat. It consumed my thoughts 24 hours a day. And now food has become a fuel.
I was excited at the idea that with this diet, it was no diet. I mean, I knew that I would get the weight off, and it was a tool that I could use to keep it off.
Bariatric surgery has helped thousands of people achieve a healthier weight by reducing cravings and limiting food intake. With proper care, patients can live a healthier life and live longer. For further information, contact Bay Bariatrics at 877-NEW-YOU.